We will talk about rosy cheeks. We will define what is normal and what is pathological. Historically, rosy cheeks were considered a sign of healthiness. Of course, it's not true. Sometimes rosy cheeks means disease, and we will discuss this condition. But first, let's define what is normal. Normal is when person has rosy cheeks after physical exercise. Sometimes it's just natural skin pigmentation, so it's genetical sometimes. But when it's genetical, usually this rosy cheeks occurs since childhood, since early childhood, and usually other family members also have rosy cheeks. When it's genetical, usually it's familiar. Rosy cheeks are normal when it's not associated with disease, and when it's not associated with disease, when there is no skin irritation, there is no changed texture of skin, when rosy cheeks texture, skin texture, and other parts of the face skin texture are same, it's normal. And there is no when there is no itchiness, or there is no allergies, there is no pimples, it can be considered normal at this case. So normal is when it's transitional, when it's genetical, and when it's familiar, and when it occurs since early childhood, when there is no irritation, there is no texture changes, so no roughness of skin. It's important. And when we have pathological rosy cheeks, first suspected disease is rosacea. Rosacea is characterized redness of skin, which can be presented on other parts of the face, for example, forehead or chin or other parts, but usually cheeks are involved. It's rosacea. And in case of rosacea, there is visible small capillaries, small blood vessels on the face skin. So you can notice small visible blood vessels, and it is known as telangiectasia. So if there is this visible small blood vessels, it can be rosacea with high probabilities. Also, in case of rosacea, there can be papules and pustules. Papules are red bumps without pus. If it's pus filled, then it's pustules. So papules are when there is just red bumps, and if it's filled with pus, it's already pustules. That's difference. And papules and pustules both are characteristic also for rosacea. Of course, it's not specific for rosacea, but if there is rosacea, there is high chance that there will be papules and pustules also. Skin thickening, also characteristic, especially in males. Generally, rosacea is more common among females, more common after the age of 30, but it can occur at any age, and it exacerbates after several factors. For example, after sunlight, after extreme temperature, after wind, it can be exacerbated. What causes rosacea? Rosacea, there is no definitive explanation why it happens, but there is three accepted main mechanisms which can be cause of rosacea. First is vascular abnormalities. Second is overactive immune response and immune system, and third is microscopic mites. But this hypothesis about mites is not well accepted, because we don't know if rosacea happens first and then these mites are replicating here and multiplying here, or mites are first. So mite infection is first or rosacea is first, we don't know. That's why we have several hypotheses. What is treatment? Treatment is usually metronidazole cream 2 times per day, Azelaic acid and ivermectin creams also are used, and sunscreen when you go out, because to protect your skin. And if first-line treatments such as metronidazole, azelaic acid, and ivermectin are not effective, then laser treatment and light therapy also used. And isotretinoin also used sometimes as if other treatments are not effective. Isotretinoin is potent medication which is usually used for treat acne, but it's also used to treat rosacea. Second common disease which we should suspect when person has rosy cheek is fifth disease. It usually occurs among children, and fifth disease has its characteristic. Characteristic is slapped cheek. The kid's cheek looks like their cheeks are slapped. It's bright red, and it's characteristic for fifth disease. And child can have low-grade fever, headache, or sore throat, or other symptoms of infection, and it's common usually age from 5 to 15. So it's childhood disease. It is caused by viruses, parvovirus B19, and it's usually self-resolving. It will self-resolve in 3 weeks. So fifth disease is not very serious condition. It will resolve itself, and it's not problem in many cases. And if it's presented in kid, usually, and if kid has this slapped cheek and this rash is very characteristic, it's fifth disease. Third common cause is atopic dermatitis. Atopic dermatitis is primarily allergic reaction. It has allergic mechanism, and immune system is overactive at these cases to irritant, and we have this dry, itchy, inflamed, and raw patches on the skin, and it's not isolated on the cheeks. Usually it occurs on other part of the face or other part of the body, but sometimes it can be presented on the cheek. So if there is dry, itchy, and inflamed skin with raw patches, it can be atopic dermatitis. It has allergic nature, and immune system is overactive at these cases, and moisturizers and topical corticosteroids are used for treatment. And another disease, important disease, which we should rule out is contact dermatitis. Contact dermatitis occurs when person has contact with allergen, or contact with, for example, poison ivy. At this case, it's poison plant, and if kid touch this plant, then rub his face, he can have this contact dermatitis and rosy cheeks. Also, other causes include allergies, sunburn, windburn, and cold weather, but these rosy cheeks are usually transitional. That's all. That are the most common causes of rosy cheeks. Usually it's rosacea, sometimes fifth disease, sometimes atopic dermatitis, sometimes contact dermatitis, sometimes allergy, but most commonly it's normal. In most people, rosy cheeks are normal. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.